Welcome to the fourth session of A Journey Through the Psychedelic Revival, sponsored by the University of Pennsylvania School of Nursing. My name is Tanya Gershman, and I'm a psychiatric mental health nurse practitioner student here at Penn Nursing. Prior to pursuing from Brandeis University in Massachusetts, I loved learning about epidemiology and the sociology of health and illness. I spent several years working in an outpatient psychiatry practice, focusing on providing patients with major depressive disorder with transcranial magnetic stimulation. I decided to push my career further by moving to Philadelphia for the Accelerated Bachelor of Nursing and Master of Nursing programs at Penn. Working with transcranial magnetic stimulation inspired my interest in nursing, psychiatry, and alternative mental health treatment. Long regarded as drugs of abuse, psychedelics have taken new shape as groundbreaking medicine with the potential to disrupt and transform our mental health care system. I hope that this session is an opportunity for all of us to become more informed about the current state of training in the field of psychedelic medicine. As many of you know, this learning series is designed to explain psychedelic-assisted therapies over a course of 6 sessions. During the first session, we learned about the history and culture of psychedelics and the most common substances used. During the second session, we talked about what happens in psychedelic therapy. For the third session, we discussed psychedelic neuroscience and pharmacology. If you missed the previous sessions, the recordings are available online and the link will be posted in the chat. Tonight, we will dive into the training landscape for psychedelic therapists. Following tonight, our last 2 sessions will be panels of experts in our field discussing the future of psychedelics and how people can gain access to them. Please note that you need to register separately for each session. I would like to take this opportunity to thank our School of Nursing Dean, Dr. Antonia Villarruel, for supporting this series. In addition to the Dean's support, we have a hardworking team operating behind the scenes to make this happen. Thank you to our team for your dedication to this learning series. 2 items of housekeeping before we start. 1, some people have been having tech issues. First and foremost, we're working very hard to avoid tech issues as much as possible, and we apologize for any issues that have been experienced. A few suggestions that may help. If you are having a bad connection, please try closing out any extra browsers or programs running on your computer. We also find that this platform works best on Google Chrome if you are logging on from a web browser. And lastly, if you or somebody you know cannot log on to the session, the easiest thing to do is to re-register for the event and get a new event link. If you continue to have issues, at the bottom of the event email, there's a link to the Blue Jeans tech support team. Please use that to contact Blue Jeans directly. 2, if you're interested in receiving nursing continuing education credit, we will post the link for the evaluation in the chat near the end of the session, so please keep an eye out for that and know that it will be posted before the session is over. The deadline for submitting for credit is this Sunday night, March 6th at midnight. A certificate will be sent via email by April 12th after the conclusion of the series. You can use the chat to ask additional questions, but I hope that clears up some of the most common questions and issues that have come up. You're in for another thought-provoking and engaging journey. Listening to a personal story is a great way to illuminate how valuable psychedelic-assisted therapies can be. That's why we start each session with a short video to humanize and personalize this type of therapy. Afterwards, I'll introduce our speaker for tonight, Karen Cooper. She will talk for about 45 minutes, and then we'll have plenty of time for Q&A. This is a unique opportunity to have a leader in the field answer your questions. Please use the Q&A function rather than the chat for any questions that you would like to ask Karen. You'll be able to like your favorite questions, which will help us identify which questions should be prioritized. We'll do our best to make sure that Karen has time to answer as many questions as possible. If you have questions that aren't specifically directed to Karen tonight, please post them in the chat and we'll do our best to answer them. For tonight's video, we are going to hear Muffy's story. I wanted to mention that this video contains descriptions of traumatic events, including sexual assault and physical violence that may be disturbing to viewers. Therefore, we recommend viewer discretion. We recognize that some in the audience may have also experienced significant traumas, so please feel free to step away or mute if you feel it would be helpful. And now, our video.
I'm Elizabeth Faith, and everybody calls me Muffy. I've often thought about if I were ever to write a book, where would it start? And I would say that mine starts with trauma. I mean, I grew up in a very loving tribe. 8 children. I'm the last of 8. My dad was mean, and I don't think he liked us very much. I don't think he liked him very much. My mother never stood up to him. She condoned it by doing nothing. I was constantly told how stupid I was. So I think some people fight back and try to be perfect. I just gave up. I let go of the rope. We went to a private school, and I met this person that was just incredible. And her name was Carlotta. We were crazy good friends. And we spent every waking moment together. She had a boyfriend. He was 16 and she was 14. He was the quarterback of the football team. And they had gone and parked in a baseball field in the middle of the day. And they came over and pulled her out of the car and shot Tommy twice in the side of the head in front of her. And then they grabbed her and put her in the car. They all raped her. She put her head down. They shot her 5 times in the back of the head. I dressed her. I picked out her outfit. And it was just the beginning of the big wall that went up. I froze it in the eyes of a 14-year-old. I made sense of it in the eyes of a 14-year-old, in the heart of a 14-year-old. And God picked the wrong one. It was supposed to be me. I was used to being punished. He picked the wrong one. And I lived with that forever. There begins, I lost me. And I created this alternate person made of steel. That I didn't kill myself is a miracle. But I toyed with it all day long. The real you starves to death. The real you needs healing. The real you is deep inside of you in so much pain. And that's where I met Michael Mithoefer. And Michael had said to me, hey, we're doing this study, and I think that would be good for you. And I thought, okay, all in, I'll do it. He gives me the medicine, and they sat with me. And then, damn, that thing hit. That medicine hit. I saw myself on the back of a boat, and the water's dark and rolling and rolling and rolling, and I can see that she's down there. But if I save her, I could die. But I have to, what do I do? And I dove in and pulled her up onto a beach, and I'm sure it's Carlotta. And I go to push her hair back to give her CPR, and it's my face. And I just threw back into the chair because I was like not expecting that at all. But it was crystal clear that I didn't have a choice. I had to save me. And those were the kind of visuals that would come to me. That medicine, that therapy. I'm all right brain, but it's as if the drug is an oil that goes on top of concrete and gets around all the edges. And then with the help of the therapist sitting next to you in a safe environment, they're able to pull that back. And they can pull it back all the way, halfway, but it's coming back. And they pull that off, and what floats up is what has been in your heart, body, soul, physical, everything. I mean, it's been in your skin. You don't even realize it. It becomes part of you. And here comes the emotions, and here come the feelings and the memories of why it happened. And that's massive, because all of a sudden I mattered. I've never mattered before, but I mattered enough that I didn't want to live like this anymore. I get a chance at being who I was born to be. And without it, I don't have a fucking chance. It's the most incredible gift. I get to have value. I deserve to live.
Thank you, Muffy, for very courageously sharing your story. Listening to you explain how this treatment helped you heal fills me with hope about the potential of this type of therapy. Our speaker tonight, Karen Cooper, is going to help us learn how we can get involved in this emerging field and support people like Muffy. Karen Cooper is Instructional Supervisor with the Center for Psychedelic Therapies and Research at the California Institute of Integral Studies in San Francisco and serves as guest faculty, admissions and screening advisor, and mentor, and helped launch their inaugural program. Her experience includes being a clinical sub-investigator in therapy Dyad and project manager for the MAPS Phase 2 and 3 MDMA-Assisted Therapy for PTSD in Colorado. Karen was lead guide, trainer, and clinical research nurse for Usona and University of Wisconsin's Phase 1 Psilocybin Pharmacokinetic Study in Madison, Wisconsin. She has published several journal articles regarding psilocybin, with over 30 years of experience as a registered and public health nurse, as well as being a licensed massage therapist, certified yoga teacher, and Reiki practitioner. Karen brings a unique knowledge base to our lecture tonight. Before we move on to tonight's presentation, a reminder to please keep in mind that the information shared here is for educational purposes only. Penn Nursing and the speakers in this learning series do not endorse or encourage the use of illegal substances. With that, I offer a warm welcome to Karen Cooper. We appreciate your time with us tonight to talk about such an interesting topic.
Thank you so much, Anya. Oh, that was such a compelling video, and it really brings back many memories of being with people during those experiences and the healing potential when the therapy is carefully implemented. And I'll just start my slideshow here, if you bear with me for a moment. So, current landscape of psychedelic medicine training and how to get involved. I do want to let you know that I've tried to incorporate as much as possible information for those of you who are interested in getting training as a guide therapist or monitor, we sometimes call them, or just for the general public for your information. And I do have a disclaimer. I am employed by California Institute of Integral Studies in San Francisco. Although
I'm sorry, Karen, we're not seeing your presentation.
Oh, okay, let me try again. About now. Is that working?
Yes, just click the swap displays at the top because we're seeing the notes view.
Okay, we practiced this. Let's see. Try one more time. I apologize.
That's it.
But I'm not seeing my screen now. Goodness, okay.
Karen, I'm able to share your PowerPoint too if we're not able to get this.
Why don't we do that? Because I'm not, I can look over to the side. It seems kind of awkward.
Okay.
Can you see the slide that's advanced?
Yes,
no,
I see.
I think I.
Oh.
Go ahead.
I was going to say, I just see the you're sharing your screen window.
Okay, so the one that says disclaimer, the slide that says disclaimer?
No, I don't, and on my end, I don't see the PowerPoint at all.
Okay, can you share from your end and advance the slides for me?
Yes.
Let's go ahead and do that. We practiced this several times. I apologize to those of you who are witnessing this technical difficulty. Ivory, you'll let me know when to proceed.
Ivory, we're not seeing it full screen right now.
I'm sorry, it was showing full screen on my end. Technology is just not our friend today.
While you're doing that, I think I can go through some disclaimers if that's okay.
Okay.
Mentioned I'm an employee of California Institute of Integral Studies, and we have a program, the Center for Psychedelic Therapies and Research, and it is one of the programs that I'll be mentioning during this slideshow that provides, I have an affiliation with them. And I would like to read a personal disclosure and an invitation to you while we're waiting for our tech to get organized. And this is something that is fairly new to me, so but I feel that it's very timely and very important for this field. I'm a female married heterosexual elder. I'm a mother and grandmother, a biracial child of a mother from another country, and I hesitate to use the word immigrant because my mother does not like that word. I'm a registered nurse, one who has a non-denominational spirituality beliefs. I have a higher education, and I've never lived outside of the United States. I was raised in a suburban working class family environment, and although I have some life experiences of gender, racial, economic, class, cultural, religious, occupational, and age-related micro and macroaggressions that have been inflicted upon me, I've also experienced personal, educational, and professional benefits of living as this identity. And I acknowledge that this presentation is influenced by my current lens of experience. I do want to mention that I truly honor the indigenous elders who've contributed their knowledge of plant medicines for healing, as well as the contemporary pioneers of psychedelic exploration. And I appreciate those who stewarded and shared the land that we have lived in through generations. Recognize that historically many of our institutions were founded upon and continue to enact exclusions, displacement, and erasures of indigenous and non-Caucasian peoples. And there's really no reparation for these kinds of atrocities to these and other marginalized populations, BIPOC, LGBTQI, and others. So I begin to make a personal effort by supporting several organizations, and I believe that this handout is on the website, so I won't go into those, but I do hope that you'll take a look at them. It's really my desire to facilitate a culture of kindness and safety, acceptance, curiosity, and belonging, respect, and collaboration, promote individual and collective healing and well-being. My desire to help humanity evolve to higher levels of conscious awareness and connection with all beings in the time-space continuum, and to be aware of and to listen to and to learn from those who may have different wisdom from myself, different life experiences, and different views from myself. I believe that psychedelic, entactogen, and other psychoactive molecules have great medicinal and healing potential. And perhaps they may help us move towards these pains. I do want to take a moment before moving on also to invite you to alert me to any blind spots or offensive material that I may present inadvertently, and I apologize in advance for any ignorance in this regard or insensitivities. I'd also like to invite you to take a moment with me, just a brief moment at least, for silence and maybe perhaps taking a breath together that I'll guide you through in regards to the events that are happening in the Ukraine and the invasion to Russia. And this is something that I've often done with study participants to begin a session. So if you'll just take a breath in and let it out. You can have eyes open or closed, whatever works for you. And just sending a deep gratitude for privileges that we have here, and also sending perhaps a breath of peace or love, well wishes to those who are in the Ukraine, perhaps in a very fearful time, and also taking a breath and a moment to send the same intention to people in Russia who are also innocent and maybe can be a difficult time. And we are hoping that through this field of psychedelic therapies and research, we'll get more towards the collaboration and peace that we all see. Thank you. Yes. Okay.
Okay, Ivory's all set. Are you want her to advance?
Oh, yes. Next slide, please. We can go to the next slide. And that was my personal disclosure. These are the learning objectives, 2 requirements related to clinical applications. I'm hoping you'll learn about that in regards to this field, and also identify several organizations that provide training for psychedelic assisted therapy and research, or that offer education and resources to the general public, as I mentioned. And also, I'm hoping that you'll be able to identify ways to get involved in the advancement of this field. Next slide. And these are some program disclosures. Tanya has mentioned some of those. There's no commercial support of this activity. Go to the next one, please. And these, I believe, are on the website as well. And next, yep. And we've talked about this already, so we can go to the next slide. So I often get the question asked, are we there yet? Kind of like children in the car. And we're not at prescription status or legalization yet. If you've attended this series, you're probably aware of that, but I know some of you may be today. And basically, we're taking baby steps. And go to the next slide. And these are some quotes that I really appreciate from Pro Football Hall of Famer Joe Namath, and also historian and sociologist William Graham Sumner. And Joe says, "First I prepare, then I have faith." And we're very much in the preparation stage right now. And the following quote by William Graham Sumner, "What we prepare for is what we shall get." So that's where the faith comes in. We're preparing now, we're laying groundwork, we're doing research, we're trying to figure out, what standards work and what diagnoses these medicines and therapies might be helpful for. And what we shall get then, hopefully, will be legalization of these medicines and therapies, perhaps as early as 2023. Next slide, please. So the question comes up, what's likely to be part of the approval process for psychedelic therapies? And number one, I would say it's always needs to be supervised. These medicines and therapies are not for everybody. In fact, for some people, they could cause harm. And so we need to have these supervised, and I'll talk more about that supervision in a little bit. Also, what's likely to be part of the approval process, it's not a take-home or over-the-counter treatment. And this is something that people have talked about and perhaps done a lot of virtual visits during the pandemic or even before that in mental health. But with psychedelics, there are several reasons why it's not likely to get approved as a take-home or over-the-counter treatment. Next slide. So I want to bring up this term REMS, and REMS stands for Risk Evaluation and Mitigation Strategy. And this is something that I think might be new to people, unless you're perhaps a prescriber already, but I do want to introduce it. REMS is a drug safety program that the U.S. Food and Drug Administration can require for certain medications. And the purpose, its design, is to reinforce medication use behaviors and actions that support the safe use of that medication. So this is an effort towards safety. Next slide, please. So the FDA requires REMS to ensure the benefits of the medication outweigh the risks. We're in the research phases now, moving closer and closer to prescription status, but it's very informed consent is very important, and this part of informed consent is telling anybody that's going to participate in these therapies or ingest the medicine what the risks are. And in the United States, the REMS apply 2 years post-production or legalization, and in Europe, it goes through the life of the drug cycle. So in different countries, we may have some different regulations or regulatory bodies, Canada, for example, and the intention is still the same as the REMS in the US. The next slide. So who needs to know about REMS? Well, healthcare providers with prescribing privileges, so physicians, physician's assistants, nurse practitioners, and perhaps other providers. If you're a clinician, like maybe a psychotherapist interested in offering psychedelic assisted therapies and research, and I would include nurses in that group, whether you're licensed as a mental health practitioner or not. At this point, we're not quite sure what's going to be approved as far as who would be the clinicians or what might be called, I use the term guide therapists, in offering these therapies. It also could be very helpful for anyone considering ingesting these medicines or medications to know about REMS. Right? So the next question is, why do we need to know this? As far as my presentation goes, completion of training. So the REMS could indicate whether particular types of training standards need to be made. It may also give you a parameter for documenting counseling with patients. Certainly as nurses, we talk to patients all the time about medications before we administer anything. So this might be a restriction for anybody who is going to be counseling patients, even if they're not the therapist or administering the medication. And then some other things that are on this slide. And just to mention, the REMS usually come from the drug manufacturer or labeling. So this would be on the package insert. Next slide. The likely REMS for psilocybin and MDMA. These are the two drugs that are most likely to be approved first. MDMA perhaps as early as 2023, depending on when we finish the phase 3 studies, and psilocybin a couple of years after that. So one of the things that, there's a question about whether it's unsustainable. The current model is 2 guide therapists providing therapies to the individual or to the patient or the study participant. And that can be pretty pricey, having two therapists, as well as if the current protocols are approved for clinical use, then it's several what we call preparatory sessions in advance. Usually those are about 90 minutes long, and then there's a long medicine day, 6 or 8 hours, depending on the medication that's used. And then there's integration, which is at least several more 60 to 90 minute sessions afterwards. And then we may repeat that once or twice more, depending on the protocol. So that could be quite expensive. What might be more sustainable are ideas that are forming now, and I encourage those of you who are looking into entering the research arena to consider, how can we make these therapies more sustainable? Having a facilitator or a guide therapist and a client on camera with a clinical supervisor in another room during concurrent sessions, kind of like the intensive care unit with a bunch of monitors, and maybe that's an idea that might be able to work. So you could have somebody that could come in if something untoward happens. Perhaps a way to go would be Dyads working with groups for integration, similar to the study that they've done at UCSF for men who had, gay men who had HIV. They had prep sessions and they had a medicine day with their guide facilitator, but did their processing work in a group with others who had their own individual sessions. Also, likely REMS for psilocybin MDA might include credentialing or certifications of doctors, or therapists, co-therapists, or anybody that has going to serve in the guide facilitator or monitor role. Kind of use those terms interchangeably. And next slide, please. So location is another consideration. Right now, we're in the clinical research setting, and in the future, there might be designated clinics with certified clinicians and facilitators. It looks like we're moving towards that model, but in the long run, many of us hope that community-based organizations would be a setting or location, as well as for-profit centers. They may be involved in not just funding, but really as healing centers. Public's going to drive the push for access, and so we are encouraged. It seems like there's momentum for this field to support, to have this move forward, and we believe that once the medicines are approved they'll be approved for certain DSM diagnoses. In the case of MDMA right now, it's for severe post-traumatic stress disorder, so PTSD. And for psilocybin right now, it looks like for treatment-resistant depression, although in Canada and some other areas for end-of-life issues, psilocybin may be approved also. So less severe symptoms will also be approved. So this would be maybe off-label use, or we'll just have more studies that will show that there's more indications, the initial ones that get approved. The REMS may include various models of delivery in the future, and this remains to be seen. So somatic-based psychotherapy, having groups, more integration therapy, or more preparation sessions than our current protocols, psycholytic or low dosing rather than very high dosing. We may have family involvement. In the past, before drugs were scheduled, there was couples therapy with MDMA, for example. And hopefully we'll have a lot of community alliance building. And this is one of the reasons why the emphasis might be put on community-based organizations as a location, because these are organizations who know the community. They often serve populations that have poor access, so we're hoping for community alliance building. And this is another area that those of you who are excited about the field would really need contributions there. Next slide. What about the type of training? Well, what about standardized professional certification? Will that be on REMS? We don't know yet. Educational degrees, the types of professional licensing, and the role of the lay public. These are all questions that are up for discussion right now. Next slide. And SpongeBob says, we don't know yet. So these are all works in progress, and I hope that you'll be able to get involved with some of the resources that I'll mention later to get these conversations going. Next slide. So currently, the current foci of training is, of course, research, because these drugs are Schedule I. That means that they're not legally used for anything other than research purposes. And I do want to mention there are several states, cities that have decriminalized psilocybin and other psychedelic drugs, but there's a difference between legalization and decriminalization. So right now it's illegal to administer these drugs outside of the research setting. There's also training for clinicians in mental health, therapy, and psychiatry. There's growing interest for that population. And there's training for prescribers and pharmacists. These might be people that are not really interested in serving as a guide therapist with somebody, but we need more people to get trained in this area of psychopharmacology. There are organizations that are on the resource list that will be provided to you that are already providing psychedelic integration training, and this is helping somebody to integrate an experience, a non-ordinary state experience that they've had into their daily life, so that it's not just a trip, or it's not just what happened there or something that happened during a retreat, but it's a way of helping people to find meaning in applications into their daily life. And then other trainings, ketamine-assisted psychotherapy, cannabis-assisted psychotherapy, there's trainings for those, as well as harm reduction education and informed choices training. And the harm reduction is very important, I think, because it is part of informed consent and weighing those benefits and risks that I mentioned. There also are trainings that could be for licensed people or unlicensed people. That's not the focus of this presentation, but I do want to alert people that they have been available in the past and continue to be offered in certain areas or communities. The indigenous or traditional trainings often were apprentice models where people prepare very carefully and for long periods of time, working to create a ceremony in a spiritual or religious context, or to sit or attend to somebody who's experiencing a psychedelic journey. And there's other wellness practitioners not focused on medical paradigm, might be what you would call underground or recreational personal experience, and that's not really the focus of my day, but I did want to mention that those are out there, and it's really important to know what you're getting into if you do want to sign up for a training program. Right? So types of training research, the study site and specific roles for particular protocols. That training is going on now, and because studies are happening now. There are programs training pharmacists specifically. I know there's one, a fairly new one, at University of Wisconsin-Madison. There's also training for therapists who will be using the expanded access, or what's known as compassionate use process. This is where individuals apply for their patient or client, basically saying they've tried everything. It would be discompassionate to not allow them to try this therapy and psychedelic medication. It is something that happens during the phase 3 research phases, So there is some informed consent and safety data that needs to be gathered, so it would be considered. And in Canada, they have some exemptions now that have recently come up for legal psychedelic assisted therapy using psilocybin, which is one of the active compounds found in what's known as magic mushrooms. Next slide. I mentioned the indigenous traditional types of training and harm reduction already. You can go to the next slide. One thing I will say about the harm reduction or psychoeducation component is that often there's very good trainings for volunteers. The ALMA project or Zendo project, which is on the resource list, are excellent. And I know that the ALMA project does have, they're in the state of Oregon, and they do have therapists and trainers who are persons of color. And so we're really needing to expand more people who have not had access or opportunity to being therapists, as well as study participants or patients' clients. So psychedelic guide therapists for these various medicines are offered. The trainings right now are offered for the research setting as well as other legal settings. In other countries, for example, psilocybin truffles are not illegal in Amsterdam, or perhaps Costa Rica or Peru, ayahuasca not illegal. So there is training that is legal that you can obtain if you go to another country. And then I mentioned the expanded access training. That's really needs to, right now, is for MDMA in the US, and you have to be a MAPS trained therapist already and be part of an approved site for in that clinical setting, and that would be MDMA for PTSD. I mentioned integration training and cannabis-assisted psychotherapy. Many people don't consider cannabis psychedelic. It does have psychoactive components to it. We know some of this, but we're still learning more about how this might be another medicine that could be used. And MAPS, the Multidisciplinary Association of Psychedelic Studies, has funded some cannabis therapy as well as the MDMA. Next slide. There is supportive training. I put ketamine in this category. Ketamine for psychotherapy is actually an off-label use. Ketamine is considered to be an anesthetic, very good safety profile. It's even been used on children as a safe anesthesia for many, many years. And one of the side effects, as people were coming post-surgical were coming out of the effects of this medicine, was that they were, having visions, and it was very scary because they weren't prepared for that. And so in the past, we would tamp that down with medications, calm them down, and rest or sleep. But somebody said, this seems like a psychedelic, and I wonder if it could be helpful in that. So we have CAP, ketamine-assisted psychotherapy, and there is training for that that's occurring now, and this medicine has been used to treat depression and other conditions in the psychiatric field. Supportive training can also be done without medication at all. So breath work, Stan Grof, the Grof transpersonal breath work, that was the original holotropic breath work. There's another organization that has a holotropic breath work brand now. There's also pranayama, ancient practices from India and other countries. They've used breath work as a way of helping people to get to a non-ordinary state and without any medication at all. Some of these, as I mentioned before, the psychedelics would be contraindicated for individuals. So this kind of breath work can be very helpful. They're not able to take medicine for various reasons. Body work, we do use body work sometimes in working with study participants and in the future with clients. And so somatic-oriented psychotherapy modalities such as a Comey method or somatic experiencing can be very supportive, and these can be introduced during the preparatory sessions. Acupressure or acupuncture, perhaps. These might be used to help treat side effects if somebody has a headache, for example, and they might not be used on what I call medicine day or the treatment day, but they might be used at integration or afterwards or at the end of the day when the medicine is wearing off. And then modified massage therapy. For some people that can not be safe feeling for them, but for others it can be just the kind of ethical touch that they need. And as nurses, we're used to having our hands on people, always with consent, and that consent is very important when utilizing psychedelics as well, maybe even more important. Next. So other supportive practices include guided imagery, other deep meditation. This can be really useful for clients when psychedelics are contraindicated, as I mentioned, but also in a phase 3 study, that means that nobody knows who's going to get the placebo or the actual drug. Therapists don't know, the study participants don't know. If people have experience with psychedelics before, they will often say, I will know the difference. But if they think they got placebo, or if the medicine is ineffective for them, it might not be. They might be treatment resistant to these medicines. So these supportive practices can be very helpful during those times. And also, I have found them something like guided imagery to be a great rehearsal. With headphones and eye shades on a day or two before during a preparation session to give the study participant an idea of what will be happening on medicine day and what that feels like. And we'll often use guided imagery or some of the music from our playlist as a way of alleviating anxiety. And some people just really take off on a journey just with that. And then there's other conventional therapies, as I've mentioned, that can be very helpful depending on the population that you're working with. You might want to learn about or get training to be trauma informed, or EMDR is a therapy that's useful for PTSD, and then there's other therapies as well. Next slide. So organizations that currently provide training focused on psychedelic therapy and research, and or that you may get involved with to further psychedelic research and therapies. So I did a similar presentation to this one at the Santa Symposium in September, and I felt obligated to update. So this was one of the slides that I used. You can see there's 7 that are mentioned here. And next slide. And then there were another group of organizations. So I had 13 organizations. This slide says wait, because when I did further investigation more recently, we can go to the next slide, I actually came up with 46 organizations, and these are available to you on the website and I think perhaps in the chat today. So there was 46, and I've included volunteer opportunities or trainings like the Zendo Project. There's also intercollegiate clubs, psychedelic clubs now, and there's a whole psychedelic network of intercollegiate clubs. These are student clubs at different universities around the world. They're journal clubs or discussion groups, and they're serving as a gathering place for students interested in psychedelic medicine. So you might just want to know more about this, and you can meet with like-minded people who are also interested in discussing the pros and cons of different studies or medicines and just in learning more. There's psychedelic societies, meetups, there's community groups around the world, and I think it's really important to think about your intentions and to really investigate who's running these groups or who participates, or go and find out, because some of them may have different values than you do. Some of them may be promoting underground therapy or illegal use or recreational use. And part of harm reduction is providing information so that people can make an informed choice themselves. So I don't have anything against something that's not research oriented, but if research and what you can do currently is of interest, you want to find out about that before participating in these organizations. I have made an effort also to include the Fireside Project, and I mentioned the ALMA organization. Those who provide education and volunteer opportunities to people of color, marginalized populations, and I think it's very important that we continue to support those organizations and hopefully grow them. You can see the rest of the details of the resource list on the website. The next slide, please. So these research-sponsored trainings, what I mean by that is that you have to be hired and trained with them. So basically right now, you would have to be at an academic institution or a clinical study site. So you can get MAPS therapist training without being at one of those places, but you wouldn't be able to work as in the research setting unless you were part of one of those teams. I mentioned MAPS, a Multidisciplinary Association for Psychedelic Studies. Hefter Research Institute actually is an organization who with generous donors who funded some of the initial research that started this, what we call Renaissance, back up. And they funded NYU and Johns Hopkins and others, and began to publish the literature in ways that we could understand the benefits and get over the fears that were promulgated, I would say, by the war on drugs. Since then, since those early days, Hopkins has received generous funding and created a Center for Psychedelic and Consciousness Research. So they are doing lots of study. You can look at their website to see what kind of training might be involved or available. Basically, you have to be a postdoc or somebody at their institution. The Usona Institute is a not-for-profit organization who is conducting and funding psilocybin studies. And then there's others. At Mount Sinai, there's a Center for Psychedelic Psychotherapy and Trauma. Berkeley has a center that will have training soon and plans to do research there. And then Compass Pathways is a for-profit organization that's currently doing psilocybin studies in Europe and the United States. Basically, you'd have to be hired in order to get these trainings. Next slide. However, there's other online courses and workshops and trainings. This slide is just one that I put up there to show you that there are even free courses, and anybody can take these. This is from the Psychedelic Support website, and there are many recorded sessions. Some of them are very stellar lectures, and you can take a look at that. This resource list as well. So this is a really good way to get free training and just kind of learn a little bit more if you're on the beginning of exploring trainings before investing a lot of time or money in applying for a program. Next slide. So I've often been asked, what are the desirable requirements? How do I get into your program, basically? And it really depends on who's offering the program. So some of them require professional licensure. You might be an allied health professional like an EMT, or more commonly physicians, nurse practitioners, RNs, especially prescribers. Some programs say licensed therapists or professional counselors only, social workers. I know in our program at CIIS, we have a long list of various licensed professionals that would qualify, pharmacists, requirement for particular training programs. And then there's others. It's really helpful if you have some knowledge of research, literature, and legalities other than a magazine article, or even though it's a great read and very useful, other than Michael Pollan's book, that's kind of a doorway into learning about these therapies. But it really would behoove people that are interested in applying to training programs to know a little bit more that's from the professional scientific literature. It's helpful if you've had therapy supervision hours. I will speak from personal experience that this work can be very intense, and the training can be really rigorous and intense. So it can be helpful to have greater self-awareness and notice countertransference as you're working with your therapy dyad partner or your training partners during the training program. And it's really helpful, in my opinion, it's essential to have a consistent personal awareness practice. And what I mean by that would be consistent meditation, not just every once in a while you sit down for 5 minutes with an app, but a progressive application of meditation practice, practicing presence, centering prayer, having creative pursuits, something that can allow you full expression of yourself, because you will hear a lot of very sad stories, similar to what we saw in the video in the beginning of this presentation. And there are also stories of joy and hope, but these kinds of consistent practices can help you during a training program as well as when you're doing this clinical work to really protect yourself, I would say. Exercise can be very helpful, as well as learning elements of ceremony or ritual for yourself. So for example, before I would go into any session with a study participant, I would stop at the before going to meet them or before going into the therapy room, take a moment of a deep breath and focus on what my intentions were and to let those go so that the study participant or the client that I'm serving, about them, remembering it's about them, not me. That was part of my ritual. Sometimes as a body worker, at the end of a session, I always wash my hands and I would just imagine, stress and anything that I've taken on that's not mine through their sharing, let that go down the drain. So those can be very helpful during training if you feel stressed out as well. Next slide. And this slide I just put in because there are a variety of, in the literature or there's publications that can help you as part of a training too. A paper by Dr. Phelps, the director of our program, about developing guidelines and competencies. I know that Andrew Penn mentioned this article in his presentation that I wanted to mention in here. It can be helpful to know, even if you're not planning to be trained as a guide or psychedelic therapist, what are the, how do we determine the qualities and qualifications of people who will be offering this therapy to me or someone that I might refer? And then the book on the right by Ben Sessa and Michael Winkelman is quite comprehensive, Advances in Psychedelic Medicine. It's pretty readily available. It is rather on the more expensive side. It's about $75, but it's very, very thorough. And if you can borrow a copy or get a copy, that might give you a very good idea of the aspects that would be really helpful to be covered in a training program. Next slide. So things to look at. There is there is a handout, but we can go to the next slide. I mentioned the competencies. These are the 6 ones that Dr. Phelps outlines, and it's really helpful if you are going into this field or have entered it to have started to develop some of these competencies. Empathetic abiding presence, very important to really sit with people. Sometimes people are inward processing quite deeply, and your job there as sitting with them, being their higher therapist, is really to have empathy and just to be present with it, whatever their experience is. Trust enhancement, very important as with any kind of therapy in nursing and other health professions. Spiritual intelligence, and she does go into defining this a little bit. I don't have time to go into that much in my presentation today. Knowledge of the physical and psychological effects of psychedelics is important. This would be a little bit of psychopharmacology, neurobiology, really knowing a little bit about the chemistry of these medications and the trajectory of the medications so that you can share that with your client or your study participant. At first you might not feel anything. Sometimes people, after about 20 minutes or so, feel some tingling. Sometimes the medicine hits them all at once, and then that may last for, I'm just giving an example, may last for a couple of hours before there's kind of a very open period towards the middle or end of the day where a lot of insights might be gained. It can be very important just to help them anticipate the effects of the medicine. Another competency would be therapist self-awareness and ethical integrity. And ethics, I think, is an area that really needs more support and exploration. So I encourage you to really investigate, what are codes of ethics there, and how could I evaluate whether there's a therapist offering, this service that they have integrity. And then I mentioned the supportive or complementary techniques that can be very helpful if you've started to develop some of these practices. And so the code of ethics, I would say it's worth exploring, looking around. On the last page of the resources list, there are some examples there, and there isn't one standard. You might be bound by code of ethics from your profession if you're a licensed professional, but there right now isn't one that's a standard for psychedelic guide therapists. So more work to do. Next slide. I feel like I talked really. Oh,
sorry, go ahead.
I feel like I talked really fast. I hope the timing is okay. I wasn't able to see the time.
Yeah, I think so. I think we've got plenty of time. That was a really interesting presentation. Thank you so much. I'm looking forward to delving into some questions from the audience. But first, Karen, I wanted to ask you the following. How do you think psychedelic medicine can begin to be more integrated into healthcare education?
I think one of the things that's happening, beginning to happen now, is a collaboration. For those of us who are already offering training programs, there's an interest in sharing information. So why reinvent the wheel? It's kind of the question. So reaching out to organizations who offer these trainings, if you're working at an educational institution, like conferences like this are wonderful because there are many people who have been in an graduated from an educational institution. As an alumni, you may have some way or credibility or a way of encouraging introduction of this. And I think what's been most successful to date has been starting with, where we're at with the research literature, because that can be a way to introduce these kinds of therapies. For some people, they're very scary, they're very frightened. And so by showing them the literature and doing a presentation maybe at your institution, or We've had some student groups that have really educated themselves and then campaigned their teachers, or they've done presentations in classes. So those are a variety of ways.
Okay. And what is your favorite assumption to dispel when advocating for the modality?
My favorite assumption would be that psychedelics are not a magic bullet for everybody. They are not going to work for everybody. There are really some people, as I mentioned, that it won't be useful for or safe for. And I usually couch that in with the wonderful potential and the healing benefits that we have seen for many, many people.
Okay, thank you. The next question we have is this one. We unfortunately live in a managed healthcare system. Do you anticipate insurance companies to cover the use of these medications and integration?
Yes, I do. I like to say that emphatically. The Dr. Bronner's company has just recently included ketamine-assisted psychotherapy in their insurance for their employees. They are very forward-thinking and have been very supportive of the psychedelic space and therapies for quite some time now, with funding and other promotional activities. And we do have people that are working with the insurance industry and regulatory agencies moving in this direction. Otherwise, it's only going to be accessible to people who have, $10,000 or like that. So I do think we'll move in that direction. And there are some disadvantages to that too. If you don't have insurance, or is the insurance company going to, make restrictions? Are they going to fund enough? Those are things that we need to work on more.
Yeah, of course. Well, I'm glad to hear your positivity regarding insurance coverage in the future, because $10,000 is a large sum. The next question we have from the Q&A is this one. Are there guidelines in these programs that require therapists or other providers guiding clients in psychedelic-assisted therapies to have participated in psychedelic-assisted therapy themselves?
So if I'm understanding the question correctly, is basically, does a psychedelic therapist need to have psychedelic experience, personal experience? There's controversy about that. I will share from my own personal experience as an MDMA trained therapist. I was offered the opportunity as part of my training to be a study participant. And so I went through the informed consent process. There was placebo versus medication, and in the same setting with two therapists. And it was very, very helpful. I had not had any experience with MDMA before, and I feel that the preparation, as well as the effects of the medicine for me, I thought I couldn't tell. Did I get it or not? I don't know. I felt very connected with my therapist, whether I had during the prep sessions when there's no medicine on board. And so it can be very helpful. Other people, otherwise, if you've been in an altered or non-ordinary state, it might be childbirth, for example. I mean, you can really go into whole nother mind space with childbirth and have an intense experience. And other spiritual ceremonial experiences in altered states. So some people really feel that having that particular medicine would be very important, and others, beg to differ. Still learning about that, but I think it's very helpful for most people, if it's not contraindicated, to go through that experience.
Yeah, we're definitely
in a controlled thing.
And we're all learning together here, which is very exciting. Okay, Karen, how would you recommend carrying the Indigenous knowledge forward? What programs or trainings are you aware of that honor Indigenous knowledge?
That's really not my specialty. Hopefully most, I know our program and several others, Naropa University comes to mind, do have speakers, so we're very careful about avoiding cultural appropriation. We want to have appreciation and honoring those traditions. I think that there are programs that, again, take a look at who's offering them and what their backgrounds are. There is the Native American Church and some others who have trained people in their community, and that's very different than what we're doing in the research setting. That's community support and community based, and typically apprentices. But I don't have expertise in that area. I'm learning more. There are elders out there that are willing to share their knowledge, but I don't have a great deal of knowledge about that.
Yeah, I appreciate your honesty about that. I think that was an important question to ask. This next question I'm interested in. How do you assess whether someone is a good or a bad fit for psychedelic medicine?
Yeah, that comes during the screening and preparation phase. Mm-hmm. So in research, there's certain protocol. We use screening tools, but similar to a nursing assessment, we might not do a head to toe because we need to look at everything. So we during the preparation sessions for the psilocybin studies, for example, we had healthy volunteers, but we still wanted to know everything about them. So we did a life review. We want to know everything about you. Let's start with where you were born and your family, and the stories come forth from that. We, of course, look at, there's a physical exam, medical and psychiatric history, medications that they're on. So there's quite a bit involved with the screening process. And the other is, does the client or the study participant, after meeting with their therapist, feel that this would be something that they're ready for? When they go in a study, they can drop out at any point. And sometimes it has happened in the very beginning. Once they get more information about what's involved, the benefits and the risks of being in a study, then they might decide this is not the right time for me or the right study for me.
Are there certain things regarding the physical exam in particular that you look for?
Yeah, and it might depend on the medication. So if you are on some of the psychoactive antidepressants, SSRIs, for example, work on the same receptors as a drug like psilocybin or MDMA, and so it might be that they have to be able to tolerate getting off their current psychiatric medications, for example. Uncontrolled hypertension would be another one. Because the medicine day is 6 or 8 hours, and there may be fasting the night before required. I don't know if that will happen. Approval, is in place. Diabetes, if you're, really can't ingest food and, it affects your insulin level, that might be contraindicated. Yeah, and there's some cardiac conditions and others that are specific for medications like MDMA.
Gotcha. Thank you for clarifying that for me. So the next question we have is a bit long, so just bear with me. Along with the previous question, as licensed professionals, how do we place limits and boundaries for clients at high risk for transference onto their practitioner while under the influence and afterglow of psychedelics?
Really very, very good question. Transference is going to happen. It happens in traditional psychotherapy. It happens in our relationship with our as nurses and other professionals. And so I don't know if we can prevent it. What we need to do is be aware that it happens. And we talk during the preparatory sessions. I've talked to study participants about what transference is, and in language that they can understand, and that may or may not come up. There's also countertransference. The therapist, sometimes people are suffering so greatly, especially coming into these studies, severe PTSD, horrible stories for many, many years, as we, witnessed in that video.
Yeah.
and multiple traumas, and your heart goes out to these people, or you may feel like parenting them. So countertransference is very important to be aware of as well. And then you work with it. Oh, I was feeling so protective when you said that. I was noticing that I might have said something that was, kind of a mothering. Was that your experience? Or through establishing that trust and therapeutic alliance, then the person that is the client or study participant, will share. They've shared things like, I'm kind of afraid of your partner. Like maybe they had a male perpetrator, and I don't want him to get close to me or her to get close to me.
Okay. Yeah.
Did that answer the question?
Yeah, I think so. I was just soaking it in. Definitely transference and countertransference, something important to keep in mind, not just in psychedelic therapy, but any practice in psychiatry. So the next question is this one. How important is traditional psychotherapy training to doing effective integration work? Are there other backgrounds that allow people to do integration work?
I think traditional psychotherapy can be very helpful for integration. Again, it might depend on the severity of the diagnosis and the population that you're working with. Certainly, if trauma has been involved, you want to be trauma informed. I am not trained or licensed as a mental health nurse or practitioner or a psychotherapist, but I do have over 350 hours of training in this field, and much of that has included psychology and support. The integration is very different, I think, than preparing for being a guide therapist with medicine. And it is something that you can implement now. I think what can be helpful for some people is task-oriented cognitive behavioral therapy. For others, it will be something that's more transpersonal or spiritual in nature. So basically, you take what's in your current toolbox and utilize that. What doesn't work is judgment. So that empathic abiding presence, really listening fully to the story and not discounting, oh, I don't believe that happened. Oh, it doesn't mean that. But really listening to the client's perception, what we call their inner healing intelligence, is really important, I think, more than any particular type of therapy. But I did mention Hakomi, somatic experiencing. Those can be very helpful to people who have experienced trauma. And if you have somebody that's suicidal, certainly you need to have training in how to assess the severity and what to do when people are feeling so hopeless.
Yeah, I like that term, inner healing intelligence.
Yes, we all have that. You have it, I have it. And people that have, study participants that I work with have felt like they're so messed up and full of shame that they don't have any inner wisdom. But we really trust that in them more than what's inside of me. It's my inner wisdom, intelligence is great for me, but I don't know, what's going on in the mind of the person, experience of the person in front of me unless they share that. So we trust them, and the medicine will often amplify their inner healing intelligence, the recognition of it, like Muffy mentioned in the film.
Yeah, it definitely is such a personal experience. What is the process for becoming credentialed, and who's involved in the planning for that?
So there is no credential right now. There's certification programs. And to be honest, it's a piece of paper that says you graduated from this program. And there is a movement working towards standardization. So there would be a standard certification for psychedelic guide therapists. I'm hoping that'll happen in the near future, because that will help us to develop the code of ethics and a process for reporting infractions or for promoting certain things that really work. Can you repeat the question again?
What is the process for becoming credentialed and who's involved in the planning?
Okay. So I can't really answer who's involved. There's many people that are involved in moving towards credentialing. The state of Oregon is a little bit different because they do have a legalization, a law in place. So there's entities there that will be involved in deciding what kind of training people need and what kind of credential, whether it's a lay person, it's a certificate, or a professional license of some sort. So when I was talking about the REMS, I mentioned the things that were most likely, as far as and what current training programs are moving towards. We do have, there's other occupations, chaplains, nutritionists sometimes need to be involved, like maybe it's an eating disorder study or a patient.
What was the first one you said prior to nutritionist?
Chaplain.
Oh, chaplain.
Yeah. A pastor.
Yeah.
And that could be, any religion.
Yeah. Okay. I think we have time for one or two more questions before we wrap it up. The next question I have for you, Karen, is what is an area of psychedelics that you feel should be researched or that to your knowledge has yet to be explored?
That's a really big question. I have like a million ideas for research. So a wider variety of psychoactive medications studied, all the way from bench science. There's molecules that are invented that are not just psilocybin and MDMA, but analogs and ones that operate on different kinds of receptors. So I think that needs further investigation.
Okay. Well, it's just
Did
about 7. Yeah, it did. Let me see if I have one more to ask you prior to wrapping up. But I think with 6 minutes remaining of the series today, maybe it's time to do our outro. And if there are any questions that haven't been answered, we will look into it. Let's do one quick one before wrapping up. What piece of advice do you have for students getting involved?
Do it. Yeah, I encourage you, if you feel like you have a passion for it, to perhaps start with one of the intercollegiate groups that are on the handout and get the discussion going. Just learn about it. And you may or may not have psychedelic experiences. They might be with the medications or otherwise, and just to really be open to the fact that there are a variety of experiences and meanings that come from those experiences. And yours may be part of that, but it's important to really listen and to keep up your hope for this field. There's so much going on in the world now that is causing pain and suffering, and these medicines may be helpful. And we need you, students, to carry on this work, long after I'm gone. I hope that people will.
Yeah, I agree. I mean, starting the conversation as we're doing here is vital to this. So it's 7:55 p.m., so this wraps up our Q&A. Thank you, Karen, and thank you, everyone, for joining us tonight. And again, a big thank you to Karen Cooper for sharing your knowledge and passion with us. We hope everyone found it interesting and informative. You'll be receiving an email within the next few days, which will include a link to the recording of tonight's session, some resources that Karen recommends, information about nursing continuing education credits, and a feedback survey. We encourage you to share your feedback as we strive to improve the series and consider future psychedelic learning opportunities. The next session in this series, called The Future of Psychedelic Medicine, will be on Wednesday, March 16th, 2022, at the same time as tonight from 6:30 p.m. to 8 p.m. Registration for each session needs to be done individually. If you are not able to watch it live, if you did register, you will receive a follow-up email with a link to the recording. Thank you all for joining us tonight, and we hope to see you for the next session.